Dr. Beard was an embryologist working at the University of Edinburgh, and he, through a complicated series of events that I've given 3-hour lectures on him, realized that pancreatic enzymes, I'm not going to do that today, I promise, realized pancreatic enzymes have an anti-cancer effect. Now, pancreatic enzymes had been discovered in 1858 by Kuhn, K-U-H-N-E, who was a German scientist who first isolated trypsin, which is the main pancreas enzyme that digests protein. And by 1900, pancreatic enzymes were well characterized. They were proteolytic enzymes, which simply digest proteins in the small intestine, amylolytic, which digests carbohydrates, and lipolytic, that break down fats. And they were well known, and they were thought to have only digestive function. But Dr. Beard said, yeah, they do help with digestion, of course, but in addition, they represent the body's main defense against cancer and would be useful as a cancer treatment. In the years between 1902 and 1911, he put his thesis to the test. He did animal studies. You know, we think of 100 years ago was a primitive time in science. They were very sophisticated. They had laboratory models, animal models for cancer, which he used. He had clinical studies going where he showed clearly the enzymes reverse cancer. He was absolutely right. Enzymes, we believe, are the main defense against cancer. All our successes because we treat patients with large doses of pancreatic enzymes. We use a pig source because the pig pancreatic enzymes are most like the human, so they work best in the human as opposed to lamb will work, but not as well as pig. They're made for us in New Zealand. They really work. We've done animal studies as well as basic clinical studies that show they work. On the program with all the good nutrition, every cell gets the signal to start house cleaning. And they start dumping these stored toxins into the bloodstream. They're filtered in the liver and the kidney. The body gets rid of them. Also, tumors are very abnormal, and they produce all kinds of molecules that are foreign and toxic to normal, healthy tissue. So when the enzymes start breaking down a tumor, you get all those dead tumor waste. It can be extremely toxic. In fact, oncologists have recognized a syndrome called tumor lysis syndrome. When chemo shrinks a tumor too quickly, chemo will work and shrink the tumor some of the time. If you break a tumor down too fast, orthodox oncologists have said you can kill the patient from the dead tumor waste. They call it tumor lysis syndrome, which lysis just means break down the cells. And you can cause hepatic liver failure or kidney failure.